Hello and welcome to our AP Euro video all about medical practices in the 17th century. Let's get right into it.
Up to this point in European medical practices, the main theme that was used was faith healing. This practice was popular in rural areas, and the main cause of sickness or illness was believed to be caused by evil spirits.
One of the most popular ways, if not the only way to treat these illnesses, was by an exorcism. If you don't know what exorcism is, it was basically a way to drive out the evil spirits that were believed to be derived from the devil.
However, many government and some religious officials tried to eliminate these practices as they thought that they were not working well. This resistance towards these practices ultimately ended up failing. However, a new wave was upon some lands in Europe, and it was labeled as urban medical practices.
People called apothecaries were basically pharmacists and were considered medical professionals at the time. They gave out different kinds of medicines and sold various herbs and potions that they transformed into medicines to give out to the sick. This treatment was advertised through newspapers and flyers.
Before we continue diving deeper into this field of medicine that is rising, let's take a look at how people got involved in the medical field. With the emergence of hospitals, outgoing physicians were required to train through an apprenticeship in the hospital while gaining experience. Diagnoses were made mainly through letters sent to the patient or conversations between the doctor and the patient. An important part of these diagnoses were that they were made through little physical examination and mostly on speculation. The main gender in this field were men. Usually, men that became doctors or physicians came from a wealthy background with a lot of socioeconomic influence. In conjunction to this, doctors helped out the urban patient 10 times out of 10 before helping out less fortunate people. Interestingly, 18th century surgeons were often compared to butchers and barbers, which shows how being a surgeon wasn't yet considered to be an honor or a higher role in society.
The main methods through this time period that were believed to cure all diseases were purging and bloodletting. However, as time passed, physicians were more willing to try new methods other than the traditional practices that still had a strong hold on medicine. An example of this comes from improvements to childbirth. During this time period, most women had an average of 5 to 6 kids, so giving birth was a huge ordeal to go through. Midwives were common up to this era, and through the support of midwives, friends, and close relatives, the baby was delivered.
Due to the influence from the Enlightenment and medicine, improvements to childbirth were slowly made. A woman by the name of Madame Angelique Marguerite Laboursier de Coudray completed a 3-year apprenticeship and was a member of the Prison Surgeon's Guide. Her aim was to educate rural midwives in Auvergne, France.
In addition to this, teaching methods improved from reading to actual sensory details that were happening to the patient. The obstetrical model was a life-size female model made up of fabric for live demonstrations. The specific parts represented were the pelvis, womb, ligaments, vagina, bladder, and the rectum. Also, they would include the artificial child with flexible joints for positioning purposes.
Another key part from Du Courget's work was the book that she published in 1757, which was called The Manual on Art of Childbirth. This piece of work incorporated her hands-on teaching methods and served as a reference for students and graduates. After the publication of her book, the government supported and allowed the teaching of this nationwide.
Now moving on to improvements in surgery.
Specifically, surgeons in the army would have an endless chance to practice their medical texts due to the battlefield conditions. The surgeons focused on saving limbs and extensive wounds and the use of cauterization, which helped reduce the risk of death. Amputation was also a common treatment when it came to more severe injuries. Amputation is what would create a flat surface for cauterization.
Except there were many challenges when it came to amputation, such as pain management and unsanitary conditions. With the lack of effective anesthesia and no understanding of bacteriology, there was a high risk of agony and shock to patients after surgery. The risk of simple wounds led to death and high mortality rates were associated with surgical procedures.
Moving back to midwifery. Midwives were the main caregivers. They were trained from other women practitioners, which were often regulated by the local guides. These midwives would assist in labor at home, provide childcare, and treat several different sorts of health issues, such as irregular menstrual cycles, breastfeeding difficulties, inheritity, and venereal diseases.
Forceps are a tool invented to assist in childbirth and were publicized in 1734, their main purpose being to assist with a smoother delivery by guiding the baby's head out of the birth canal while the mother pushes the baby the rest of the way out. After the invention of forceps became publicized, surgeon-physicians used their monopoly over this and other instruments to seek lucrative new business. Attacking midwives as ignorant and dangerous, they sought to undermine faith in midwives and persuaded growing numbers of wealthy women of the superiority of their services.
Surgeons attacked midwives as uneducated and dangerous to seek medical help from. Louis Lapeyre, a male expert in the medical field, published his book, An Inquiry into the Merits of These Two Important Questions, expressing his opinions about midwives. He wrote about midwifery, revealing a high critical and dismissive view of midwives and how they are the lowest class of human beings, also stating that for a woman, becoming a midwife is not a demanding or skilled profession, but rather a last resort for women who are incapable of doing anything else.
Two other key people were Lady Mary Wortley Montagu and Edward Jenner. Lady Mary Wortley Montagu would learn about smallpox and start an induction practice which was risky. Patients were contagious and this practice was widely condemned, including a 1-to-5 death ratio of patients.
Edward Jenner was a country doctor who also worked with smallpox, finding that cowpox was an alike disease to smallpox except it was milder and not contagious, allowing him to use cowpox as vaccines. Edward published his findings in 1798, a couple years after smallpox declined. With all that being said, medical practices experienced much change and continuity during this time period. We hope you enjoyed our documentary and that you learned something new. Thank you.